Hello and welcome. My name is Brandon Wilson. I am a customer service rep here at Canada Life. And today we're going to be talking about your new benefit program that is going live June 1st, 2023. So, a quick agenda for the topics that we'll be discussing today. First and foremost is your group benefits overview. So, we'll be talking about exactly what the plan covers. Then we'll be moving into My Canada Life at Work. This is your one stop hub for anything related to your benefit plan, what it covers, claims, all of that. Then we'll be talking about some additional wellness resources that you and your family have access to as a Canada Life member. And then from there, we'll be discussing portable benefits and freedom experience. So, first and foremost, welcome to Benefits with Canada Life. I've included a couple of key pointers here to just keep in mind. So, for any expenses that have been incurred prior to June 1st, 2023, please make sure to submit these to Manulife as soon as possible. After May 31st, you will no longer have access to the online portal. So, if you do have claims that are still not submitted, it will be a little bit more difficult. So, just try to get in there as soon as possible and submit those claims. For any expenses that have been incurred June 1st and afterwards, those will come to us. So feel free to submit them directly to Canada Life, and we will help you with those. Another pointer here, so for anything that you have received a prior authorization for, any drugs or drug exceptions, just make sure that you go into Manulife again before May 31st and pull that explanation of benefits for those approved claims. When you go to submit those claims to us, just attach a copy of that with your receipt, and then we will make sure to honor those for you. Okay, and now your benefit program. So there's a few main numbers that you're going to need to know, especially your policy numbers. This will all be available to you once you register, and it will be on your benefit card, which will be on the member portal. But just so you have that as well for you. So policy 180496, this is going to be linked to your life, dependent life, accidental death and dismemberment, long-term disability, travel assistance, as well as your wellness account. Policy 52237. This is linked to health, dental, as well as your health and healthcare spending account. I've also included a couple of key numbers here for you. So the first one is for our customer service center. So if you have any questions with regards to coverage, or if you've submitted some claims, you have some questions about, you can call the 1-800-957-9777 number. Pending, this will be available to you as of June 1st when the plan goes live. So keeping that in mind. If you're having issues registering online, you're having technical trouble, you can call 1-888-222-0775. And then lastly, benefits administration services. If you have any questions about your enrollment invitation or while you're enrolling, you can call this team as well. Okay, so moving into your actual benefits. So the first piece is your basic life and accidental death and dismemberment. So, basic life is if there was a life claim, this is the benefit that would be paid out to your beneficiary that you have indicated when you enroll on the plan. So, this is paid out at a one-time annual earnings to an overall maximum of 400,000. There is no non-evidence maximum, so depending on your salary, what your eligibility is, you would not need to supply any medical evidence for that amount. This does reduce by 50% at the age of 65, and then the termination date for your life and AD&D is to retirement. Your accidental death and dismemberment, this is an amount that is equal to your life insurance. For dependent life, this is in the case of a dependent life claim. This would be a flat 10,000 for your spouse and a flat 5,000 for a child. It terminates when you are no longer covered on the plan, or your dependent is no longer considered an eligible dependent on the plan. So long-term disability, if you ever were to get in a place where you are unable to work due to an illness or an injury, long-term disability will work as an income replacement for a longer duration. The waiting period is 26 weeks. This does coincide with the EI sickness benefit. Your benefit formula, so how the amount that you're paid out is calculated, is 60% of your earnings. There's no non-evidence maximum again, which is great. And the eligibility for the overall maximum is 5,000 per month. This is a non-taxable benefit, which is also great. So if you were to go on a long-term disability claim, that benefit amount that you're receiving will be non-taxable, so you'll get that full amount. It does terminate at age 65, and then the own occupation for long-term disability is 2 years. Moving into prescription drugs. So, your drugs are covered at an 80% coinsurance and 100% at Costco. So, I have another slide just talking about that a little bit further. But do want to keep in mind that unfortunately, this is excluding Quebec residents just due to RANQ legislation. We are unable to do that. There is no deductible associated with your prescription drugs. There is a dispensing fee limit of $5. The plan will cover up to $5 per dispensing fee, so keep that in mind when you're choosing your pharmacy. And there is enhanced generic substitution for your drugs. The drug coverage is subject to an overall health maximum of 50,000 per year. So that overall health maximum is for all your health benefits. Again, 50,000 per year, and then it resets. Health is covered as well to retirement. So as mentioned, if you do choose to fill your prescriptions at Costco, they will actually be covered at 100% coinsurance, which is amazing. You don't actually need a membership to Costco in order to use this, which is awesome. You can just let them know that you are filling a prescription and they'll let you through to do that. You're going to provide them with your benefit card as usual, so just keep that in mind. Costco also has a really great home delivery service, so you can set that up so that you get your prescriptions delivered to you. As mentioned, the plan does cover enhanced generic substitution. And essentially, what this means is that the reimbursement of a prescription is limited to the cost of the lowest priced generic option. So, generic drugs are usually less expensive than the brand name drug, but they are just as effective. It's generally the the non-medical ingredients that are varying, but they have the same active chemical ingredients, the same dosage, same strength, all of that. So keeping that in mind as well. If there is a medical reason why you're unable to take a generic version of a drug, for example, you have an allergy to one of the non-medical ingredients in the drug, there is a form that you can complete that will your doctor can fill out as well, and then you'll be able to apply to get the cost of the brand name covered. Paramedical practitioners. So you have an 80% coinsurance for paramedical practitioners, and this is to a $750 combined maximum per year. With the exception here, I've highlighted for physiotherapists. So the physiotherapist coverage is actually 100% coinsurance, which is great, and then to a $1,000 maximum. So it has that separate maximum there as well, so you can really utilize that if needed. Okay, next is your medical supplies. So these do have 100% coinsurance. Hearing aids are covered to a maximum of $500 per 5 years. Orthopedic shoes would be one pair per year. This will be limited to the reasonable and customary charge in your area. Foot orthotics would be $300 per year. And then blood glucose monitoring machines is one every 4 years. Similar to the rest of your health benefits, this would terminate at retirement. And again, all of these would fall under that overall health maximum of $50,000 per year. Okay, you also have coverage for out of country emergency care. This is covered at 100%. So if you are traveling, whether it's for business, for personal, whatever it may be, and you do find that you need to go to the hospital because of an emergency, you would have coverage for that. So it wouldn't be for, like a pre-existing or an anticipated thing, or if you have an ongoing issue that you're going to make appointments for and reoccurring, that wouldn't be the case. But if it's for an emergency, then you would have that coverage. So as mentioned, it's 100% covered, and there is a separate maximum for this, which is 5 million per lifetime. In conjunction with the out of country emergency, you also have coverage for travel assistance. So this will be included on your benefit card, that number that you can call. It's a direct 24/7 line that you can talk to someone. It's available in multiple languages, and they can coordinate you to find the closest hospital or physician. They can also assist with if there is an intake needed and you do need to pay in order to be taken into the hospital. They can coordinate that. They can coordinate the whole claim for you. So, and very important that if you are traveling, you do make sure to keep a copy of this card with you. Moving into vision care. So eye exams are covered at 100% coinsurance, and this is to $90 maximum per 24 rolling months. For glasses, contact lenses, and laser eye surgery, your coverage is 70%, and this is to a maximum of 200 per 24 rolling months. Again, this is for child and adults. And then similarly to the rest of your health benefits, the termination is retirement. For dental care, so for your basic diagnostic, preventative, restorative, endodontics, periodontics, your regular checkups, cleanings, those are covered at an 80% coinsurance. For your major dental, which is crowns, dentures, and bridges, this is covered at a 50% coinsurance. You do have the combined maximum here, so it's $1,000 combined per year. And the fee guide that is going to be used to assess how much is covered is based on the current year's fee guide for the area that you are in. I always like to recommend, especially for dental treatments, anything that's a little bit over, like a little expensive. Usually I'd say over $200, $300. Just make sure that you're getting a predetermination completed prior. This is just essentially an estimate that is sent into us that we review and determine exactly what will be covered under the plan before you actually go through and submit the claim. Okay, so moving into your healthcare spending account, and we'll also talk a little bit about your wellness account. But each year you'll be provided with $500 for your healthcare spending account, and this can be actually allocated between either your healthcare spending account or your wellness account, so you can kind of assess what works best for you and which one you think would be more beneficial for you. There's no carry forward on these funds, so do keep that in mind. Specifically for the healthcare spending account, these are for health related expenses, and it is non taxable. So keep that in mind too. This is for anything that's really considered a medical expense through the CRA. So, if perhaps you want to use it for the remaining coinsurance, if something is only, let's say, an 80% coinsurance, you can submit the remaining 20% through your healthcare spending account. If you've maxed out something, you could use, let's say, for dental, for example, you could put it through your healthcare spending account. If there's something a little bit more expensive that you only have, let's say, for vision as an example, the maximum is $200, but you want to buy a pair of glasses that are $500, you could use the remaining amount and put that through your healthcare spending account as well. So just a few examples there. Your wellness account is a little different. So this is a taxable account. So again, keeping that in mind. But as mentioned, $500, you can put it towards either account. Wellness related accounts. So this is actually more for anything like gym memberships, exercise equipment, sports clubs fees, those kinds of things. Okay. And then just moving into My Canada Life at Work. So, as I previously mentioned, My Canada Life at Work is your member portal. This is where you're going to access all the information with regards to your benefit plan. When you are completing your enrollment invitations, that is going to be the last step that you are prompted to do. It's going to ask you to register for this site. Please make sure to do that. This is the best and easiest way to submit claims, access your information. Everything is electronic, so it's a really great resource for you. Some of the features that you have access to through My Canada Life at Work, you can access what exactly the plan covers. You can look at the balances to see what your remaining are. So let's say you have gone for your physio appointments. You can look exactly what has been used for out of that $1,000 maximum and exactly what you have remaining so you can kind of keep track. You can submit claims directly online, so everything is done electronically. It's just a quick send a picture of your receipt, fill in some information about the provider and the claim, and submit everything electronically. You can also set up direct deposit so that when you do submit claims online, we can then reimburse you directly to your bank account. And you also have access to your digital benefits card, as previously mentioned. So, with this, you can save it to your phone's wallet. You can print a copy if you prefer to have a hard copy. So, there's a few different options there for you. This is just a quick little screenshot of essentially what the dashboard is going to look like when you log in. So you'll see right here, you can access your health, drugs, vision, dental. It'll show you exactly what is covered. Under the drugs piece, there's also a really great feature called the drug search tool. So you would just go in and click on that little drugs icon. You can go to drug search tool. And it will show you exactly what a drug is covered for. So you're going to put in either the DIN number of the drug or the name of the drug. And you'll say if it's covered by the plan, what the coverage is, or if it requires prior authorization in order to be covered. So, something to keep in mind. You can always look at that before going through and purchasing a drug without knowing if the plan covers it. You can also, as mentioned, get your benefits information. So, exactly what the coverage is, what your remaining balances are. You can pull a summary of your claims so you can see the status of your claims. You can pull all your claim history if you need that for tax purposes. Everything will have an explanation of benefits there for you as well, so you can review that. There's also under resources, you can use the find a provider feature. So essentially what this is you can look up different providers in your area. So whether that be massage therapists, physiotherapists, things like that. You can look up a full listing and it will show all of the providers in your area that are able to submit direct claims to us. So that's a great feature there for you as well. You'll also have access to all of the different wellness resources that I'm going to talk a little bit more about now. And then you will also have access to portable benefits, which we'll talk about a little bit later in the presentation. So along with the My Canada Life at Work website, we also have GroupNet for plan members, and this is a mobile app. So you can download this either on your Samsung, your iPhone. It is available for both options, and it has the exact same functionalities as the My Canada Life at Work member portal. So again, you can view your card. This is the great one because you can actually just save a copy of your benefit card to your phone's wallet directly through the app, which is great. You can submit claims like you normally would, view your access, view your coverage. You can use the Find a Healthcare Provider tool here as well. It will just use the GPS on your phone. And you can also set up personalized notifications. So if you want to get text messages or emails, whatever it may be, you can set up notifications so that you get an indication when your claim has been approved, when it's been paid out, those kinds of things. So you can personalize that to whatever preference you like. Now, just talking about some additional wellness resources. Again, these are available to you and your family as Canada Life members. The first one is Health Connected. So, this is essentially our online virtual wellness portal. This really seeks to help with your overall kind of health and wellness with a few different tools and resources. So it is available online. We do have a mobile offering as well, so you can log in on your web browser on your phone. The first thing it's going to ask you to do when you log in is conduct a health assessment. So it's going to ask you a series of questions with regards to different health risks, focusing really on different things like nutrition, exercise, alcohol consumption, financial wellness. So, kind of looking at everything very holistically. After you answer all of those questions, it's going to advise what your health risk is for these different areas. From there, you're going to get different resources and tools to help with that specific health risk, whichever one kind of came up as your top health risk, and you'll get very personalized resources with regards to that specific health risk. You do have access to a digital health coach, so you can speak to, someone online and have access to that health coach, so you can really kind of key in on your goals and that health risk again to kind of help with those assessments. You can have team and solo challenges. So if you do have, there's walking challenges, sleep, nutrition, there's preset challenges on there. So you can have those if you like to, kind of just compete against yourself, or if you like to work as a team, you can have those set up for your colleagues and yourself. It does also integrate with top fitness apps. So you can actually integrate this with your Apple Watch, let's say, or if you have a fitness app on your phone, it can keep track of your steps, and they work in conjunction. The next piece that you have access to through Health Connected is a digital health library. So, this is a series of health articles from qualified professionals, really on a multitude of different topics. So, if you want to look up different health conditions on there, different drugs, if you're trying a new drug, you can look into that specific drug, get some more information, medical procedures, natural health products. So, again, it's a very wide arrayment of different articles. So you have that available to you to look at on your own time. And then lastly, you can sign up for monthly health newsletters so you get those sent directly to you each month. The next piece that you have access to is workplace strategies for mental health. This is actually a free resource to all Canadians. So, this is something that we introduced during COVID, but it's had such a great uptake that we are still offering this free for everyone. So, the website is there for you. It's workplacestrategiesformentalhealth.com. And this just, again, is a series of different articles and resources to assist with your overall mental health and well being. So if you want to look up different things and you want some support, whether you're going through a period of grief or you're experiencing some workplace bullying, addiction, performance issues, that's all available to you. So again, you can kind of go in there on your own time, on your own pace, and you have access to those additional resources. Okay, the next piece, and one of my favorites, is Consult Plus, which is essentially your virtual healthcare clinic. We like to call it a doctor in your pocket. So you will also have access to this. Similarly to the Health Connected, this is available through My Canada Life at Work. So you'll have access to that through the portal. So keeping that in mind. There is an app for it as well. So if you wanted to download the app, you could do that as well once you've logged in. Essentially, you're able to connect with medical professionals online 24/7. This is for non urgent conditions, so just keeping that in mind. But they can provide you with medical advice. They'll do an intake, if you're feeling a little bit sick for, like, let's say, a cold or a flu. Skin irritation, again, those non urgent types of things that seem to come up more frequently. But they can also do things such as fill as prescriptions. So, really very similar functionalities to a walk in clinic, but you don't actually have to even leave your house. So, how do you benefit from Consult Plus? Again, this is 24/7. So, you can speak to a medical professional whenever you need to. You don't necessarily have to go to emerge at the end of, the middle of the night if it's not something extremely serious. So, you don't have to worry about those long wait times for walk in clinics. So, keeping that in mind. It's, again, as mentioned, for non-urgent conditions. So if you do have an emergency, of course, go to an emergency clinic. They can fill prescriptions and refills for you, so it's very quick and easy. So you don't have to necessarily, go to see your doctor for those prescriptions and refills. And they can also provide requisitions for lab tests and follow up test results when it's medically needed. So, again, same functionalities as a walk-in clinic, but you don't even have to leave your house. So, if you are finding, you're very busy or you're working, maybe something comes up with your child, this is a really easy and convenient way to have access to a doctor very conveniently. So, I've used this many, many times, and it really does come in handy. It's a lot quicker. So, keeping this in mind, you do have access to this as well. And I'll show you exactly how to register that in a few slides. Another great piece that you have accessible through Consult Plus is the self led therapy, also called Internet Cognitive Behavioral Therapy. So, this is a self led therapy. So, you're able to go in really for a different support for a few different areas. So, depression, anxiety, stress, divorce and separation, if you're experiencing a loss or bereavement. So essentially similar to the health questionnaire, you would go in and you conduct a questionnaire on Consult Plus, and they'll give you a health score based on that questionnaire that you complete. From there, you will get suggestions on different modules that are specific to that health score and how you answered those questions. And there's different, again, modules and tools that you'll be asked to do. But one of the great things is that this is totally on your own pace. It is self-led, so you can go in there and access this resources, read through the modules whenever you have time or you feel like you need that additional support. So how do you access it? So as mentioned, this is accessible through your My Canada Life at Work portal. So you're just going to go to your coverages and balances. You're going to go to your health benefits, and then you're going to go to other coverage, which will be at the bottom. It'll bring you to this Consult Plus piece. You'll just click that. And it's going to go to directly to the Consult Plus website. From there, you're just going to create your account. It will register that you're a Canada Life member, so you will not need to pay anything. And then you'll just, yeah, go from there. It's just a quick little couple questions to get your account created, and then you're ready to go. All right. So the next piece we're going to talk about today is the portable benefits. As similarly to your other resources, this is something that is available directly through My Canada Life at Work. So you can do this. Everything will be done online. Portable benefits is essentially additional coverage that you can purchase for your life insurance, accidental death and dismemberment, as well as critical illness. So, this is completely optional and voluntary. But if you do decide that you would like a little bit of additional coverage, you can apply for this online through that member portal. It's very similar to optional benefits that you may have had in the past with other carriers or your other benefit plans, but a few changes that are included here. So, with your portable benefits, these are essentially set up through your account. So you would be doing this directly through My Canada Life at Work. It's a quick online application, so the pricing would be dependent similarly on your age, your gender, smoking status. Is going to ask you those kinds of questions. From there, you'll be provided with a quote to see what that cost would be, depending on how much coverage you're actually looking for. You can opt into any of these if you would like. From there, once you get the pricing, you can set up directly your payment on the account online so that it's going to take those payments directly from your account. You don't need to go through payroll deductions or anything like that. Another great piece of this is usually how it works is with optional benefits. Once you leave your group plan, you would no longer have those benefits as they're tied to your group policy. With portable benefits, if you are to leave your benefit plan, you would maintain this coverage. Because the payments are coming directly from you, it's tied to you. Those benefits would continue as long as you would like them to. So a few other notes here. So for your life insurance benefit, the main thing that I want to point out today is that you do have this non-evidence maximum 31-day eligibility period. So if you apply for the life insurance within 31 days of June 1st, you will be eligible to apply for up to $100,000 without providing any medical evidence. So we wouldn't ask for any medical evidence within that 31 days. Usually optional benefits, you do have to provide medical evidence from the first dollar. So this is a great additional feature with the portable benefits. After that 31-day eligibility period, you would have $25,000 non-evidence maximum free. And then after that, you would need to supply medical evidence for anything above $25,000. Another great piece here is the termination age for the portable benefits life insurance is actually 85. For the critical illness, you have that $25,000 non-evidence maximum. And then again, anything above that, you would have to provide medical evidence. And then AD&D, there is no medical evidence needed. Oh, sorry, I went one too soon. So again, this is a totally voluntary plan, but if you do decide that you want some extra coverage, you have this available to you. And one of the great pieces is that when you're doing that online quoting system, you can pick different amounts, kind of play with how much coverage you're looking for, and it will provide you with a quote on the pricing, so you have an idea of exactly kind of what works best for you. So as mentioned, in order to get some more information, you would just go to My Canada Life at Work. Again, as of June 1st, you can click the Offers tab, click the button that says Get a Quote and Apply Online. Again, you can pick whatever amounts work best for you, kind of play around with that, and it'll give you that quote. Once you look at your eligibility, you could go to the coverage calculator, and you'll have that there available for you. Okay. The next piece that we're going to be talking about today is the Freedom Experience. Again, this is an amazing resource that you have available to you as a Canada Life member. Through the Freedom Experience, you have actual access to our health and wealth consultants to ask them questions and get personalized and unique assistance. So I know I had talked earlier in the presentation about our customer service line. This is a little bit different as they're kind of able to assist you with, your coverage, claim inquiries, things like that. But our health and wealth consultants are really there to provide you with a personalized experience and assistance from the time that you enroll on the plan to the time that you retire or terminate from the plan. They are dedicated to help you with your specific experience and answer your questions. They're an amazing team of qualified professionals, and they are well versed, experienced professionals with the group benefit plan, so they can help you with anything that you really need with regards to this plan. From the beginning, they can help you register online. So if you're having any trouble with that on enrollment, you can call the health and wealth consultants. They have a full, clear understanding of your benefits plan. So when you book your appointment to talk with them, they have already reviewed and they know exactly what your benefit plan covers, so they can answer your questions very quickly and easily. They can also plan for your goals, big and small. So they're going to talk to you exactly about, your needs, what works best for you, and then you can kind of look at that and your goals with them. They can also answer your group plan questions. Another great piece about the health and wealth consultants is that instead of needing to, call in, wait on the line potentially for the GCCS line, they can actually, but you can book an appointment directly with the health and wealth consultants. So we've included here the link to book that appointment. So you can find a time that works best for you, go in, book an appointment to speak to someone so you don't have to necessarily wait on the line. It is virtual, which is amazing. So you have that access. You can also use this QR code to book a appointment with them directly. So this is, as mentioned, a really personalized and amazing tool. Their health and wealth consultants are great. They'll be able to provide you with different answers with regards to your benefit plan. So I do highly recommend to utilize this if you can. So that wraps up the presentation for today. If you have any questions, you can always reach out to your plan administrator. They can pass it along to our team. You have all those numbers, those resources. Please use the health and wealth consultants as well. If you have any questions, yeah, just let us know. And yeah, welcome to Canada Life, and thank you again.